Today, I've signed an order requiring shelter-in-place protocols for Tulsa. The Tulsa Safer at Home executive order will take effect at 11:59 p.m. and it will run through April 16th, at which time it will be evaluated. Over the last 2 weeks, a series of orders have been put in place to slow the spread of COVID-19 in Tulsa. And when we look around the country, we see several common traits of shelter-in-place orders as they're used in the United States. The closure of restaurants, bars, and entertainment venues, we've already done that in Tulsa. Closure of schools. The Oklahoma State Department of Education and our local districts have already done that. Closure of non-essential businesses. The governor's order earlier in this week did that. But in discussions over the last several days with my colleague in Oklahoma City, Mayor David Holt, we determined that this combination of orders was getting us close to shelter in place, but it was confusing for local law enforcement to carry out, and there was still more that needed to be done to keep our citizens safe. So the city of Tulsa and the city of Oklahoma City are today announcing safer at home orders in collaboration with one another. Unlike the safer at home order issued earlier this week by the governor, for which I am very grateful, this safer at home order applies to everyone in Tulsa, not just those over 65 years of age. You don't have to be over 65 to contract or spread COVID-19. Of the positive test cases that we've had in Tulsa County through yesterday, right about a third of them were people over 65. The other 2/3 were not. During the duration of this order, all public and private events or social gatherings are not allowed. Essential business, as defined by the state of Oklahoma, should continue to operate, but are also required to incorporate social distancing practices wherever feasible. Employees of an essential business do not need documentation to travel to and from work. Businesses deemed non-essential by the state may continue to operate so long as those operations consist of employees or contractors working remotely and not with customers. Under the Tulsa Safer at Home order, there are still plenty of things that Tulsans can continue to do. Go to the grocery, convenience, or warehouse store. Go to the pharmacy to pick up medication and other health care necessities. Go to medical appointments. Go to a restaurant for takeout, delivery, or drive-through. Care or support for a friend or family member. Take a walk, ride your bike, hike, jog, be in nature and outside for exercise, just maintaining 6 feet between you and those outside of your household. You can continue to walk your pets and take them to the vet if necessary. You can continue to help someone get necessary supplies for their health or well-being. And you can continue to work in an essential business or work remotely at a non-essential business as they are defined by the state of Oklahoma. Now, while I know that these orders seem remarkable in our history as a city, they are not remarkable when you look around our country. Of the 50 largest cities in the United States, Tulsa and Oklahoma City will today become the 44th and 45th cities of those top 50 to implement a safer at home order. I want to be clear that this is not a recommendation. This is an order to protect lives of Tulsans. It will be enforced by the Tulsa Police Department. Officers have discretion to issue citations and, if absolutely necessary, take people to jail for violation of this order. The Tulsa Safer at Home executive order, frequently asked questions, and the state of Oklahoma's essential and non-essential business list can be found at cityoftulsa.org/COVID-19. I'm implementing this order today because I believe it will save the lives of Tulsans. All of us must do what we can to slow the spread of this virus so our healthcare system can properly care for those who need it. And because it's easy to grow complacent, I want to illustrate my concern in starker terms than I have publicly to this date. I saw yesterday that a poll showed 90% of Americans are social distancing. And while that sounds pretty wonderful, it also means that 10% of Americans aren't. In the Tulsa metro, we have around 1 million people. So let's say that that national percentage applies to us locally. That's 100,000 people in our metro area who are at greater risk of infection due to physical proximity. Every model that I've seen over the last 2 weeks shows the infection rate in the Tulsa metro peaking between mid-April and mid-May. Now, on average, 80% of people who will contract this virus will not require hospitalization. They'll be able to self-care at home and get on with their lives. But that means that 20% of those, on average, who contract this virus do require hospitalization. And that would mean, under this scenario in Tulsa, if things continue as they are, that 20,000 people in the Tulsa metro are at high risk of requiring hospitalization in the next 2 months. And that's just for COVID-19. It doesn't take into consideration every other medical necessity that requires hospitalization. That is why the U.S. Army Corps of Engineers is in Tulsa today, scouting locations to construct an alternate care site. That is why it is so important that each of us approach this daily with the diligence and vigilance it requires. That is why we are taking unprecedented action locally in Tulsa to protect our fellow Tulsans. Our hospitals work like an elevator in a building. That elevator may transport hundreds of people over the course of a day, but if everyone who rides that elevator over the course of the day tries to get in it at once, it won't work. And similarly, if we can slow the spread of this virus over a longer period of time through all of us practicing social distancing, our local healthcare system can handle it. But it cannot handle a massive surge all at once. We have no margin for error here. And this is why Tulsans are safer at home.